Hi everyone, my name is Lang. I'm one of the GPs work at the Women's Clinic, and today I'm honored to talk about Women's Health Check here during this Women's Health Week. Right. In general, I understand that we are now having a coronavirus pandemic. Everyone's homebound, and we also want to emphasize how important it is to have a general health check. So, have you ever thought about how clean is a health bill? And if you have, then think about considering a well women's health check. So, what do we do when we do a well women's health check? We check your heart, we check your female reproductive system, we check your breasts, bowels, and we check your bones and the mental health as well as the skin. So who actually needs it and how do you do it? And in fact, anyone at any age older than the age of 35 and we recommend above the age of 35, but you can actually do it a bit younger if you really want to, if you're concerned, and you can. And then we do men as well, but today we're going to focus on women's health. All right. Why is it so important? It's because prevention is always better than cure. As a general practitioner, we highly emphasize on screening and helping you to achieve the much better health, to prevent nasty diseases that will actually upset your health. If you are between the age of 45 to 49 years old, or you're Aboriginal or Torres Strait Islander descent, and talk to one of us, one of your doctors or your GPs, or even one of the nurses, and you may be able to get a free government-funded health assessment. Right. Normally, the whole assessment would take up to an hour, and you sit in with a clinical nurse first, and then your GP. All right. So the first part is a heart health check. So are you at risk of heart disease? Or have you ever thought about that? And in fact, 1.4 million Australians have a high chance of having a heart attack or stroke in the next 5 years. People probably don't know about that, and we know that it's never too early or too late to manage the risks of heart disease. And actually, if you do have the risks, then we can help you to improve it. There's a lot of risk factors that we can't change, like your age, your gender, your ethnicity, your family history. However, we can improve your blood pressure, your cholesterol level, your sugar level, and whether we smoke or whether your physical activities levels as well. So regular heart health checks will actually help you to understand your risks better in the next 5 years. So some people can try out this calculator that I've put up here. Is actually to check on the absolute cardiovascular risks calculation. And then only available for people around the age 35 to 74 years of age. It's a very solid calculator funded by Heart Foundation Australia, Kidney Foundation, and Stroke Foundation Australia. So the next part is actually talking about female reproductive system. So why is it so important? And that's, I suppose, that's the main part of the women's health. We talk about your uterus, we talk about your cervix and your ovaries, as well as your vagina health. As you can see, we had Dr. Christina Tolentino talking about cervical screening tests already last week. And it is something really important for you to sort of keep up with, so that we know when do we screen for it and when do we find out the risks of it. So other stuff that we want to talk about also include your menstrual cycle, how heavy is the period, how painful is the period, is it something that we could help you to ease the symptoms or not. Endometriosis, for example, is one of the very debilitating disease that could affect a lot of women's life. And not only just provide lots of pain, it will also affect some other conditions like your fertility as well as your uterus health as well. We also offer to check on your ovary health and also your vagina health as well. In fact, we also discuss about menopausal health with women around the change of life age and or possibly earlier if you have to. And then we can go into a lot more sort of ideas about significant health risk changes due to this change of life and also its management for the menopausal symptoms. We also talk about sexual health, educate you, and provide as much of the counseling, and also do screening tests for that. In fact, if we do screen and found some disease, then we can treat it as soon as we can, and hopefully eradicate the whole disease, like infections or so. A lot of people may not know that sexually transmitted diseases are actually quite silent. They can slip in your body for a good, excuse me, for a good 18 months, sometimes after 2 years, and you may not have any symptoms. But after that, you may develop severe tummy pain or vaginal discharge, and then it will be a much complicated infections. So a lot better to actually screen it and treat it if you have it, and then move on. The next few parts is actually about family planning. Contraception is very important to provide the best family planning, and we'll also talk about your fertility wishes and provide you to go along preparation for a healthy pregnancy. So something that we can discuss throughout this Well Women's Health Chat as well. Another important female organs is actually your breasts, and every day 50 Australians will be diagnosed with breast cancer. So it's very important to know that we also want to make sure that the breasts are safe as well. Triple test will help you to understand your breast up to 99.6%. So main parts, so three main parts. So one is clinical history and a breast self-examination. Number two is a clinical examination that's done by your healthcare professionals like us and the nurses. And then number three is a mammogram and ultrasound plus or minus a biopsy. So during the Well Women's Health Chat, we'll check your breast and we'll also educate you on learning how to examine your breast and get used to examine your breast regularly as well. The next main part is about guts. It is very important because Australia has one of the highest rates of bowel cancer in the world. So it's actually the second most common cause of cancer death in Australia. Also, every 2 hours, a bowel cancer claims a life. It's about 100 people every week and over 5,300 every year. It is important to know that if we detect it early, 99% of the bowel cancers can be successfully treated or even prevented. If you treat it early and we find that like it will probably allow you to go into cancer-free period for a much longer period of time. And when you turn 50, you find that the government will send you a little present. And this gift is actually a routine bowel kit. So do remember to do that because it actually helps to detect up to about 90% of the bowel cancer in early stages. And it is really important to know that as well, regardless any age, if you are concerned about your bowel symptoms, for example, if you do develop any bleeding when you pass motions or you develop any tummy pain that you can't explain, any change of bowel motions, for example, suddenly you have hard motions and another time you had a loose motions and out of nowhere. So it is something that you need to talk to your doctors about, or some people may feel a lump in the tummy or a lump in their back passage. So it is something that is worth for you to discuss. Sometimes you may think that you want to monitor your bowels for a few weeks. It's possible, but then if the symptoms persist, then you need to speak to your GP a little bit more about the symptoms. Most important of all is to have your symptoms checked, and it might just save your life. Very important part of our body is our mind, and we talk a lot about mental health. And in fact, 3 million of Australians are living with anxiety and depression. I suppose probably a little bit more now with the coronavirus. So definitely you're not alone. And we're here to always help you. Around 1 in 6 women actually have depression. And then 1 in 3 may have anxiety in their lifetimes, and people don't talk about it. Having said that, it's important to know that we are always here to support you, and then we'll listen and advise to help you to understand the condition, and we can offer you certain plans that we can do to give you services that you can have more in terms of counseling and psychotherapy, and to learn about strategies to manage your conditions. Okay. When your life gets too big, and then when you think about something that you're not supposed to do, it's worthwhile to possibly call certain people for help as well. And if you can't find anyone near you or anyone you trusted, and then feel free to call Beyond Blue or Lifeline and Samaritan's hotline. They are actually 24/7, and they are confidential and also free as well. We also like to talk about bone, and then 2.2 million Australians are affected by osteoporosis. So once you turn 50, your risk of having an osteoporotic fracture is actually up to 42% in women and 22% in men. So osteoporosis means you have very low bone density. So something like this is really hollow. There's no more density in the bone. And then that means when it's a bit hollow, then you have a higher chance to break your bones. And osteopenia is a moderation of change of the bone density. It's lower than normal density. And when you have a normal bone, it looks very packed and then and very strong, and helping you to have a strong bone so that it doesn't break. How bad is the osteoporotic fracture? Some women may have a fracture in their hips, and some women may have a fracture in their wrists. Very commonly, you hear that women may have a wrist fracture, and that actually impact a lot of your daily activities, because your hand are the main functional sort of like important part of the joints as well. And some people may have a fracture in their spine, so it will cause tremendous pain and loss your daily activities, so ability, and or some people may not be able to walk, and it is quite a significant disease in comparison to the others that we just discussed about. Therefore, it's very important to talk to your doctor about your risk of osteoporosis, so that we can offer you appropriate investigations and find out, look, where are we sitting on the risks, and then we can then help you to provide a much better protection, and then a much better treatment for it to prevent fractures. Okay. Some other protections you may be able to do is the three main things are vitamin D that you get from the sunlight. You just got to balance out not too much of the sun exposure so that you don't get skin troubles as well. And then calcium intake, so mainly from your diet. And then lastly is actually weight-bearing exercise as well. Weight-bearing exercise means that you need to sort of carry your weight and sort of like move around. And so in a simple example will be like walking or strolling. And so not so much of cycling or swimming, because they are non-weight bear. However, there are still good exercise that you could use as a support to actually protect your joints and to provide a good bone health. Last but not least, we talk about skin cancer. It is probably one of the most, like one of the commonest skin like cancer in Australia. However, we also know that treatment can be very accessible and with good treatment outcome as well. So we highly recommend 12 monthly skin check from head to toe, and because that will help us to detect suspicious skin lesions. Certain people with excessive skin changes and a different type of skins may have a different type of risk factors, and they probably will benefit from other type of investigations like mole map. And there's also another way to sort of scan your skin and then to detect it in a much better way. However, you need to talk to your doctor a little bit more about those risk factors so that we can discuss a little bit more about it. On the other hand, adequate sun protection with sunscreen will prevent it. And so definitely do not forget about slip, slop, slide, and sick as well. And so this YouTube video here will actually show a short clip about how to do that, and probably worth educating your younger generation as well to actually start doing all this sun protection to prevent skin cancer from the young age as well. So I hope we got some messages home, and in this short presentation, prevention is always better than cure, and we hope that early detection can save your life, and we also hope that we can help to check your heart health regularly to determine your risks of cardiovascular disease, and lifestyle changes can actually provide good quality of life as well. I would highly recommend regular breast self-examination. Don't forget to do the bowel cancer screening test that the government sent to you. Also discuss with the GP about any of your concerns, and look after your mental health with confidence. And health check is also available for men. So talk to one of the GPs about this. All right, I think that's all for today. All right, thank you very much for your time.